Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about 6 most common forms of anxiety disorders. It's common to take stress and anxiety for granted. However, it might be classified as an anxiety disorder if it interferes with regular tasks. Depending on the type of anxiety illness encountered, patients may also experience physical symptoms in addition to psychological ones. What is anxiety disorder? The body's response to stress is known as an anxiety disorder, which is marked by mental and physical symptoms. When worry strikes too frequent, excessively, or both, a person is considered to have this disorder. The amygdala, a region of the brain responsible for controlling a person's emotional responses, is thought to be the origin of this anxiety disease. Even when in conditions that are normal for them, people with anxiety disorders frequently feel extremely anxious about a variety of things. Anxiety disorder symptoms to be aware of. The appearance of fear and worry about anything is the primary sign of anxiety disorders. One of the causes may be stress, and the person experiencing the problem may not be able to cope with the pressures. Keep in mind, nevertheless, that not all cases of extreme stress and anxiety qualify as anxiety disorders. When the things that were thought to be the source of anxiety have truly vanished but the anxiety still interferes with your regular activities, you are considered to have an anxiety disorder. Some of the signs and symptoms of anxiety disorders include faster heart rate, palpitations, shiver, nausea, it's challenging to focus, sweating, chest pain, dry mouth, headache, difficult to fall asleep, rapid breathing. Anxiety disorder types. There are various sorts of anxiety disorders, even if they all result in shaking and anxious symptoms. There are certain symptoms that set each type of anxiety disorder apart from the others. The numerous forms of anxiety disorders include the following. 1. Generalized anxiety disorder. Anxiety disorders like generalized anxiety disorder cause people to worry excessively over seemingly unimportant events. For instance, safety, health, finances, and general day-to-day living. Anxiety disorders of this kind can last for 6 months or more. Signs and symptoms of generalized anxiety disorder include fatigue, pain in the muscles, nauseous, headache or dizziness, having trouble relaxing and sleeping, difficult to breathe, difficulties concentrating, feeling uneasy and uptight all the time. 2. Phobia. Anxiety disorders such as phobias make a person fearful of things that don't make sense. Phobias typically involve uncommon signs like repulsion to specific animals or items, fear of heights, crowded areas, or tight locations, fear of encountering physicians, clowns, spiders, and other situations or objects that do not frighten or worry other people. People who have phobias experience excessive anxiety and fear, which might hinder the daily activities. Avoiding the phobia's trigger is the quickest approach to get over it. 3. Social anxiety disorder. The symptoms of social anxiety disorder, also known as social phobia, are characterized by the sufferer's awareness of social situations. People who have this kind of social anxiety disorder often feel terrified and ashamed when they are in crowded areas because they constantly feel like they are being observed. Work will be seriously hindered by social anxiety disorder, especially for those who work as MCs or public personalities who interact frequently with the general public. 4. PTSD, post-traumatic stress disorder. People who have previously gone through trauma that could have been fatal are more likely to suffer from this form of anxiety condition. The patient will thus experience severe anxiety and fear when recalling the incident. This condition typically affects those who have experienced violence, accidents, war, or natural disasters. People with PTSD frequently experience sadness, insomnia, excessive alcohol consumption, and a deterioration into drug abuse in addition to anxiety and fear. 5. Panic disorder. An irrational fear characterizes panic disorder. There is no prior notice given, and the following symptoms appear: rapid heart rate, sweating, headache, being sluggish. The patient's regular activities will be severely interrupted as a result of this kind of anxiety illness. 6. Obsessive compulsive disorder (OCD). OCD is a psychological condition that influences people's thoughts, obsessions, and actions, compulsions. The person who has this sort of anxiety disorder frequently feels restless, nervous, fearful, worried, and wants to repeat the same action. Additionally, people nearby patient have an odd presumption because it's challenging for the patient to maintain mental control. Furthermore, the onset of this obsessive behavior can interfere with the patient's daily activities, such as making them late for school or sluggish about doing chores. Feeling apprehensive and concerned about something is common. Be cautious, nevertheless, if the feeling persists until it starts to interfere with regular activities. Your doctor will work with you to identify the kind of anxiety condition you have and provide thorough treatment. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.